If elected, what would you do to address the shortage of doctors and other healthcare providers here in BC?
The big challenge that we face in our healthcare system in the province, and I hear it from frontline healthcare workers, I hear it from people in communities, is the shortage of doctors, nurses, and other healthcare professionals. We have a number of different strategies to take that on. First of all, recognizing and using the scope of practice of those professionals who are already out there, getting them off of the sidelines, getting them working in our hospitals, getting them providing care to British Columbians is critically important. And so, for example, we have internationally trained doctors and nurses who are ready to go, but who are tied up in getting their licenses recognized to practice here in BC. We've worked with the college to get to this point, but now we need to provide clear direction to the College of Physicians, for example, that doctors who are trained in comparable jurisdictions are able to get to work within a 6-week period. So from the UK, from Australia, for example, get off the sidelines and get to work. For doctors from across Canada, they should be able to work here on a provisional license immediately. And so we'll be issuing that direction to the college. We're also opening a new medical school in Surrey to train up the healthcare professionals we need. At UBC, adding additional residency spaces as well as 197 additional training spaces for more doctors. We've got to keep doing this work. And now's not the time to cut the healthcare system as John Rustad is proposing. Now's the time to invest, to train the healthcare workers we need so we don't find ourselves in this situation again.
Clearly, this is a huge problem in BC. We need to do more training, but that will take time. We need to look at actually purchasing training spaces from outside of the province, but that still takes some time. Over the short term, we need to clean up our ability to be able to get healthcare workers that come into BC into the system faster so that they can qualify to go through. That means we're going to have to work with the doctors and make some shifts in terms of how we go through that process for having doctors get into our system.
I think it's really important to start with the data when we talk about shortages here. We have 270 family doctors per 100,000, and that's higher than the Canadian average. What we have in BC is a shortage of family doctors willing to work in what has become a dysfunctional system. The adjustments to the pay model helped, but we need to go further with community health center model that makes sure that doctors have thriving conditions, that there's vacation time, that there's parental leave, that there's income security in the form of salaries, that there are pension plans and extended health benefits. We need to value the people who are delivering healthcare in this province, and we start by ensuring that the conditions are great for the healthcare providers. The way that we got to community health centers as a model was from literally hundreds of conversations over years with doctors and nurses and patients and experts and advocates, and then seeing the benefits of community health centers where they do exist in BC, and from Dr. Jane Philpott's book on Health for Everyone, there's a lot of evidence that shows that the way we address the working conditions for doctors so that they can best provide healthcare for people is through community health centers, and we are a big champion of that.